Webcast. This is Living Well with MS, Lifestyle, Diet, and Complementary Therapies. And I'm Kate Milliken, your moderator. Multiple sclerosis is a disease whose symptoms range from numbness and tingling to blindness and paralysis. So it's unlikely that we'll ever find a one-size-fits-all approach to living with MS. However, we have come a long way since the days of 20 years ago when people were diagnosed with what was considered an untreatable disease and sent home to rest. Today, the most common form of MS, relapsing MS, can be treated clinically with 10 FDA-approved therapies. Still, living well with MS also means understanding strategies that enhance total health and wellness. They include strategies that maximize productivity and independence, as well as strategies to help deal with the emotional, social, and vocational challenges. In this webcast, we'll focus on what living well with MS may mean to people living with all types of MS. And for me personally, living well with MS has meant balancing what I want to do with what is good for me to do. And I am constantly gaining perspective. Today, we're here to address questions that we know matter to our viewers, and we have already received nearly 1,000 questions from you, many of which we will discuss today, including applying a holistic research approach to stopping MS, restoring function, and ending MS forever, examining risk factors for MS progression, combating cognitive challenges, exploring vitamin D, oral antioxidants, and dietary salt effects on MS, exercise and rehab strategies. And to help us explore these topics, I am joined by 4 panelists who will recognize the importance of living well with MS, and do. Let me introduce them. First, we have Dr. Albert Lowe. Dr. Lowe is an associate professor of neurology and epidemiology at Brown University, associate director of the Center for Neurotechnology and Neuro-regeneration at the Providence VA, and is director of neuroscience research at the Mandel MS Center at St. Francis Hospital in Hartford, Connecticut. Dr. Lowe is studying the impact of MS on employment, interpersonal relations, and daily living, and is currently investigating robot-assisted neurorehabilitation to improve gait. Next, we have Dr. Brenda Banwell. Dr. Banwell is the Division Chief of Neurology and Professor of Pediatrics Neurology at Children's Hospital of Philadelphia and the University of Pennsylvania. She focuses on the cognitive, emotional, and imaging changes in pediatric multiple sclerosis. Welcome, Dr. Banwell.
Thank you.
And welcome, Dr. Lowe.
Thank you.
Next, we have Dr. Alan Bowling. Dr. Bowling is Medical Director of the MS Program and Director of the Complementary and Alternative Service at the Colorado Neurological Institute and a Clinical Professor of Neurology at the University of Colorado. He has been involved in research related to nutrition, dietary supplements, and other unconventional therapies. Finally, we have Dr. Timothy Coetzee. Dr. Coetzee is the Chief Research Officer at the National MS Society. Dr. Coetzee leads the Society's global investment in MS research. He is responsible for a diverse portfolio of research initiatives and recently spearheaded an effort to establish a global collaborative focused on research in progressive MS. So, hi everyone. Hi.
Be with you.
So, Dr. Banwell, why don't we start with you? I'd love to hear a little bit about the research you're doing to help people live with MS.
Okay. Well, my research focuses on pediatric MS. And so our first initiative was to learn what MS looks like in a child and how to best make the correct diagnosis. My colleagues and I are then now looking at ways to treat MS in children and specifically looking at safety, benefit, and pediatric-specific impact of medication. And then finally, we're particularly interested in what children are going to teach us about MS. The onset of MS in a child occurs at a very early stage of MS. And so our research is trying to understand what the earliest effects of MS are and what the earliest biological processes are that may get MS started.
Dr. Lowe, tell us what you've been up to, too.
So a couple big areas. One is neurorehabilitation. So one area we look at is ambulation, gait, and balance using robotic techniques. And we're starting to also look at the upper extremity, how impairments with the hand or arm can affect a person's ability to everyday activities of daily living. Another large area is the Rhode Island MS study, which is really focused on independent adult living. So patients tell me all the time they're worried about employment, taking care of themselves, and relationships with their family and loved ones. So we're looking at all those aspects in this large epidemiological study.
Dr. Bowling, you have been involved with complementary techniques for over 30 years. How might this approach enhance a person's time with MS?
Yeah, there have actually been quite a few studies in this area looking at the safety and effectiveness of these different complementary or unconventional approaches. Actually been studies in people with MS showing that half to 2/3 are interested in and or use these therapies. So it's very helpful to try to identify those therapies for people with MS that may be low risk and potentially helpful, and then on the flip side, identify therapies that have been shown to not be effective or have been shown to be unsafe. So trying to highlight which are potentially worth pursuing and which should be avoided. And these therapies can potentially help slow down the disease, help with the symptoms, and overall just improve general quality of life.
And I have to believe with people beginning to kind of look at how this can be tested and figured out on how to better people, the National MS Society must have some initiatives happening.
Sure, Kate. I mean, that's a really important part of what we do is fund, cutting-edge research. Some of the work that Dr. Lowe referenced is being funded by the Society. There's other things we're doing around lifestyle and diet. So, for example, we're taking a look at whether or not cholesterol can be tied and be predictive about what's happening with MS progression. Another case is we're examining vitamin D and looking at what role does vitamin D have to play, and could it be potentially used as a potential add-on to existing therapy. Also looking at a medical food product that could be tested in a clinical trial to see whether or not it helps with memory and cognition. But I'm also excited about the kind of work that Dr. Lowe is doing with his robots, because it can really pioneer a way for using technology to enhance the life of people with MS.
Sure, when you hear the word, robot, you think of machinery that arguably has nothing to do with a person with MS. So what is the connection?
Well, let me describe them a little bit. So these robots in the R2-D2 that come up to you, they're basically a motorized treadmill. There's a body weight support system, and the person stands in the treadmill, and an exoskeleton comes up behind them. So we had the opportunity to test this equipment about 10 years ago. It was built in Switzerland, and mostly using spinal cord injury and stroke, but never tested in MS. So we decided to test it. And what we found was you can certainly indeed improve people's walking speed, their endurance. When we looked at their quality of life, and it decreased pain, decreased fatigue, improved their life satisfaction, and also their physical component. But a couple of really interesting things also came up. The fastest speeds are not necessarily the ones the patients like the most. So probably the quality of their walking becomes very important. So we're looking into that. We also discovered that exercise is incredibly important. But these machines weigh about 2 tons. We're beginning to explore other ways they can do things at home and outside the laboratory.
You're not taking the robots home?
I'm not taking the robots home. You can, but they weigh 2 tons.
All right.
They're not portable.
You need some big muscles. So from your perspective, how much is exercise important to people's general health?
I think it's very clear that there's a dose response in terms of exercise and decreasing other health problems. So just as little as 60 minutes a week can decrease your chance of cancer, diabetes, dementia. So it's very, very important that relationship is very, very clear. So for people with MS, I think they need to begin to think about this. And an example of something we're doing as different from robots as this next topic is the role of potentially dance. Can we use dance, which is a very social activity, to promote physical activity, engage people socially, and also improve their gait and balance? So this is actually an area that we're trying to make very scientific, and also we're sort of calling it prescriptive dance. It's going to be very protocoled, and people should be able to reproduce it.
Wow. You think about, when I think about dancing, then I think that there's a total fun element that comes with it. And, if you're looking at doctors who are used to clinical research, I think it's very hard to prove on whether or not the fun factor has anything to do with how people are doing. So I kind of feel like that opens up a little bit of a discussion to all of you of how it's been for you to figure out ways to prove clinically some of these alternative techniques. Anyone want to comment on that?
Well, in pediatrics, I think we speak about fun all the time, because that's really how we engage our patients. And in pediatric stroke research, there's no question that when something is more of a game or an activity, of course the child will do it more, they recover more quickly. And I think it's equally true in adults. I think when you gain a reward from an activity, you see yourself get better at it, you gain that confidence and self-esteem that we all value. And you really do get better at it. And so I think that is just the everyday experience of what therapy means in exercise, which is that the benefit from it starts to also be visible in multiple other aspects of your life as you move forward.
Anything
I think just any process of exercising the nervous system, it could become very regimented and really, I think, not fun for a lot of people. Going to a physical therapy center, maybe doing something very regimented. So I think there's increasing recognition that for it to stick, for people to really continue with physical exercise, you really want to have a fun element, and we're probably wired to have fun in some of our lives and to have that fun connect to some of these healthful activities. Similar process with cognitive exercises. You know, a huge emphasis there now is to make those fun, because someone's not going to sit down for an hour a day and slog through laborious cognitive tasks. So same fun element.
Yeah,
I want to add one more thing, Kate. I mean, this is the exact reason why I wanted to do this, because the treadmill training is beneficial but kind of boring. I mean, there's a lot of treadmills out there as coat hangers. And we acknowledge that the fun factor is part of the clinical trial because we want it to be effective, and it's just too bad if patients say, it was so much fun and I like these people so much, but that's part of the intervention. So we acknowledge that, and that's kind of built into the study.
Sure. And having fun obviously fights from things like depression, right? So what are some of the findings on depression that might help people with MS?
Well, I think from my perspective, the first thing is to recognize that our emotional health and our physical health are all part of us. And so it is extremely important for people to recognize that this is not a separate entity. It is part of living with any human condition. Depression can happen and does happen frequently, even in the individuals, of course, who have no other health concerns. It is still something that is underdiagnosed and often not shared and discussed. I think depression can be a transient thing in someone's disease course, or it can become a major part of their disease course, and in both situations it needs to be addressed and managed. And management may or may not involve a medication, but it certainly needs to be discussed and cared for. And depression can touch not only the patient living with MS, but their spouse, their children, their parents, even their best friend, who may find it very difficult to see them have to go through MS. So I think it is something that people need to talk about, get out there, and deal with, because it's treatable.
Have you seen a change over the years of your practice, of people opening up more and it being kind of more accepted?
In our practice, yes, because we work really hard to bring it up early, and in a way where we say to people, in my teenagers, for example, I'll say about a third of my patients tell me they feel really sad some of the time, and the sadness stops them from doing something they wanted to do. Does that ever happen to you? And I do that in an environment just with the teenager and I, for example, so they feel that they can share that, and that's not uncommon. I would say that it is also very common for the mothers and fathers of my patients to endorse that this has been really hard on them. And so we try to look at this as the whole family receiving care.
I do think something you touched on, which I think we as humans, I think we like to compartmentalize things and neatly divide them. We got the mood state, we got the physical state, cognitive function. The brain isn't that way. We got these rough areas, but it's all richly interconnected. And I must say, as a clinician, as I get farther and farther into clinical practice, it really is, that compartmentalization seems very artificial and something that we really have created. For example, I think some people, you can see depression emerge when they start exercising less, almost like an exercise withdrawal syndrome bringing out.
When they stop exercising, they get more depressed?
Right, or they get more fatigue. So there's a rich interconnection. I think those can play off negatively with each other, but also positively.
And I think that's what's changing about MS in terms of how we treat it and approach it, is that we're looking at the whole person, not just one part of their life. And I think that's one of the really important changes that's happening. I also think that the work that Dr. Lowe is doing with robots is also important, because it's teaching us how other diseases and advances in things like spinal cord and stroke are benefiting MS. And so being able to look outside of our own world is really also really critical.
In the subject of compartmentalizing, I think that the 2,000 people who are part of this webcast watching would love to talk about separating the whole idea of clinical medicine and alternative or conventional therapies. And at one point, maybe Dr. Bowling, you can talk about what it was like for you 30 years ago to be in this world of non-conventional treatments, and how it's changing and becoming less segregated in your own medical community.
Sure. When I first got into this, I think many of my colleagues thought I had developed some kind of psychiatric condition, and I'd gone a little loopy, and why was I reading about herbs, and why was I self-educating myself, because I hadn't actually learned any of these approaches in medical school. So that was even up to 10 to 15 years ago, really feeling it was sort of taboo territory. It really was not an appropriate topic for certainly a program like this, any kind of public MS education program, it really was difficult to do that. So I really just started one-on-one in my office. And then I've actually been amazed over the past 15 years to see professional acceptance and professional interest in getting educated in this area. So something that was 100% of a lay education experience I was providing is now kind of 50-50 between lay audiences and professionals. That's been refreshing, and I think that's opened this up too to everyone wanting to know, well, what is the evidence? And then I think that taps into, we need to do research, and especially MS-specific research to work this through further.
Yeah, and Dr. Kutz, I would even say, so I've been living with MS since 2006, right? And I feel, having been in this world, that there's been a shift even in the past 5 years. So my personal experience of coming up with, something outside of my conventional therapy, my doctors would say, you can do whatever you want, but I wouldn't say it was widely embraced, to put it mildly. I think there's been a little bit of a shift of embracing the idea, and Dr. Kutz, maybe you can comment on that.
Yeah, no, definitely there is, as Alan mentioned, there's a definite shift. People are looking at all these different areas as being potentially promising and telling us something about how people live with MS and manage their disease. I think the key part has been to also think about it from a scientific point of view, because we want to be able to understand what is happening, and so funding some of the science and thinking what were the right questions, how to measure it, was challenging a few years ago, but now I think we have the tools to be able to understand and perhaps figure out whether or not a potential therapy is, how it's being beneficial and how it's helping somebody.
Is there an example, Dr. Kutz, that you could give on something on the horizon?
Well, I think, on what I'm excited about on the horizon is rehabilitation and exercise therapy, because that has the opportunity to span across MS. So whether or not a person lives with relapsing MS or more progressive forms of the disease, you see even in the conversation we're having the possibility that it can improve cognition, help people with depression, help with physical mobility, and improve quality of life. And I know in talking to people with MS, those small improvements in life really can make a huge difference.
One of the non-conventional things that have been coming down the pike is vitamin D. And Dr. Benwell, I'll throw this at you, because obviously you've been doing a lot of studies with kids and vitamin D. What are some pieces of advice or findings you might want to tell adults who are watching?
Okay, well, I think first, vitamin D has been looked at in a couple of ways. So there's been the initial investigations of vitamin D related to the fact that multiple sclerosis is more common in certain parts of the world than in others, and it's particularly common in parts of the world where we have relatively little or less sunshine. And our vitamin D is largely made normally from the sun acting on your skin and leading to a process of vitamin D production. We also get vitamin D from the diet, and one of the biggest changes that has happened in the last 50 to 100 years is the human diet. Not all in a good way. And so when you look at those two things together, that drove a lot of questions about why MS and why where. And so a lot of studies have now shown that lower vitamin D levels in the blood are particularly prominent in parts of the world where MS is common, and that has led to the question of whether having low vitamin D early in life, and particularly in my interest, of course, in childhood, might permit the immune system from making whatever mistake it makes that then leads to multiple sclerosis. It's not only MS. Low vitamin D, of course, has been linked to other diseases like type 1 diabetes, a disease called lupus, and many others. So then the next question also is, that's before the disease is even known to exist. Obviously, the next question is, would giving vitamin D slow the disease down in any way? And there are some early studies that suggest that relapse frequency in MS patients may be lower if they maintain a healthy vitamin D level. So the take-home message for me would be that vitamin D health is important at the population level. There are recommendations for daily ingestion of safe doses of vitamin D for children and adults that have many health important factors associated with them. And so for parents who have MS, or for parents in general, I think it's important to start vitamin D nutrition in early life, to maintain it throughout life, to speak to your healthcare provider about what vitamin D dosing is right for you, and to emphasize that vitamin D in extremely high doses is, of course, not safe, and there are monitoring techniques to be sure you're getting the right amount.
I do think, with vitamin D, the studies that we have now really are association studies, kind of showing low vitamin D associated with risk for MS or associated with increased risk for attacks. And what's coming along now. I think funding from National MS Society and other organizations are the very important intervention studies. If you give people with MS vitamin D, does that change the course relative to giving them a placebo? And those studies are just starting to come out, and it's too early to say if there's definitely that causal connection.
Dr. Bowling, one thing that Dr. Banwell brought up was the whole idea of diet. And why isn't it, everybody seems to be talking about diet in the world of MS. Why isn't there one diet that all of you very smart people can recommend for people with MS?
Yeah, I think that's a great question, and it gets back to what we were talking about earlier, which is the evidence, that we don't have enough evidence. We don't have highly rigorous studies that show evidence for a particular diet impacting the course of MS like we do with MS medications. So the data that we have, the studies that we have, it's not definitive information. I think your question does get at sort of a split, though. If you look at most people with MS who are interested in some kind of unconventional therapy, diet and dietary supplements is usually at the top of the list. But then within medical practice, I think most MS clinicians don't really talk about diet that much. So there is this split, and it relates to, generally, you want hard evidence to incorporate something into practice, but then people living with MS, understandably, may want to use some approaches where there is not definitive evidence. So I think it's a matter of, I think we need to come together and have information that's actually accessible to people with MS. Maybe it doesn't need to be part of clinical practice, but I think that's a place to come together in the moment, and then a way to come together definitively in the future is through studies to come up with something that could be incorporated into practice.
Can I comment on that?
Of course.
One of the other things is that even just like medications don't work exactly the same way in every person, what we absorb from our diet is in part influenced by what our diet has done before. So your body is very clever at absorbing what you need and relatively efficient at getting rid of things we don't. And so the same diet won't have the same effect in every person. And so there may be very good reasons for that. And so I think we have to consider what nutritional needs an individual person may need, and that's not likely even going to be the same throughout the lifespan. So I think that it's a fascinating question that requires careful thought. I think we can all identify things in the diet that probably don't help MS. We know that high cholesterol and early cardiac disease, just like it does in every other health condition, worsens any other condition the patient has. Developing diabetes and having multiple sclerosis at the same time, it certainly worsens your quality of life and your health. High salt diet may be one of the factors. So I think it might be easier to identify what diets we shouldn't be consuming. And in so doing, we may actually come up with a diet that is actually generally more beneficial overall.
Dr. Banwell, can you actually, when talking about having, let's say, diabetes and MS or whatever, kind of talk about simultaneous things happening while having MS? One of the things that I know came up with a webcast question was the whole idea of having a urinary tract and MS and how they affect each other. Can you talk about that?
Sure. So with respect to infections or fever or coexisting illness, getting the flu, all of us feel worse when we have an intercurrent illness. We feel more tired, our muscles are achy, we're more fatigued, we have maybe even a bit of confusion if we have a bad flu. Those are the same things in multiple sclerosis patients, but magnified. So your messages travel along your nerves at certain speeds. If those nerve pathways in the brain have been previously injured with MS, the messages go more slowly. And so fever or illness can bring out symptoms in a patient with multiple sclerosis quite vividly. And treating the infection, of course, then brings the person back to where they were. So it's important to know that.
One of the issues that also come up is mental acuity and cognition. So whether it be dietary or anything else, I'd love to ask all of you whether you have any tips for people on how to sharpen their brains. Dr. Lowe, do you have any thoughts?
Well, like everything in our body, we need to exercise it. So obviously reading, engaging in mental activities, educating yourself, that helps. Interestingly, exercise indirectly also benefits the brain. They've done studies in the elderly, which showed that exercising merely 30 minutes several times a week actually increased the processing speed, memory considerably, a significant amount. So there's both direct and indirect effects from exercise.
Dr. Banwell.
Well, in my patients, of course, MS starts while they're still acquiring their fundamental building blocks of education. So a big part of my job and my colleagues is to identify when children with MS are having trouble in school, to teach them differently and teach them to their abilities, and to help them through what is often a very difficult period of time. They've just been diagnosed with MS. Now they're struggling in school, and they don't even know if they'll go to college, which has been a life goal for them and their family. So identify how to put in effective learning strategies, and there are a lot we may not have time for, but there are some very effective learning strategies is absolutely essential. And I think the other thing I spend a great deal of my time on is getting the school boards to understand that you have to teach some kids differently, and children with MS may require some special help in school and be in a regular classroom, but still need some extra help.
Dr. Bowling.
Yeah, I think really dissecting down what is causing the cognitive issues. Often if someone has MS and they have cognitive issues, it is related to the MS, but there can also be other factors, especially depression, and we were talking about depression earlier. So really trying to identify if there might be some other mood issues that are going on. And then also kind of out of the complementary area, but prevention of cognitive decline, that's actually been shown with many of the disease-modifying medications that we're all quite familiar with. And also, I think there's growing area, I mentioned it earlier, but cognitive exercises, and Dr. Lowe mentioned that. So there's some preliminary evidence that some of these cognition-enhancing approaches may be helpful to people with MS. And, the approach 10 years ago of, do a crossword puzzle every day, maybe that helps, but it helps you get better at doing crossword puzzles every day. So the bigger question is, what can you do?
Makes you seem smarter.
That's right. So the bigger question is, what could you do every day cognitively that would then transfer into improved cognitive function in work or at home or your day-to-day life? So that's a very active area, and using highly sophisticated software that become individualized to the person doing the software, and hugely making that fun. That's a very active area of investigation.
And piggyback what Dr. Bowling said, oftentimes we talk now about cognitive reserve. You probably talk about neurological reserve or mood reserve even. And in preventing this, there's a lot of discussion about what can we do to prevent, dementia or decline. And clearly, people, for example, who have a higher level education before they get older, tend to get old. Their dementia tends to be, they're at less risk for having dementia. So this aspect of reserve is actually a very important concept.
Do you want to add anything, Dr. Coetzee?
No, it's great to talk about work that the society is funding, and I think what's important about this is the idea that we're looking for ways to get ahead of the disease, and so it's no longer just sort of reacting to what's happening, but really thinking forward 5, 10, 15, 20 years to really ensure that a person has the highest quality of life as possible, and that's really why it's so important to fund some of this research.
Dr. Bowling, so now that CAM, complementary techniques are kind of popular, what's trending? What are people into?
The top of the list is almost always diet and dietary supplements, and I think we've kind of covered vitamin D, and to me that's sort of at the top of the list, and I think that actually that whole topic kind of highlights, is that unconventional or is that conventional? And some conventional physicians get offended if I put it on the unconventional category, so that just kind of, it doesn't really matter. I mean, it's an area we need to understand. So that's kind of the top of the list. I think an area that sometimes is forgotten is vitamin B12. The multiple studies, this goes back many years now, but there's a subgroup of people with MS who are at risk for vitamin B12 deficiency. Vitamin B12 deficiency mimics many of the symptoms of MS, fatigue, cognitive difficulties, walking problems. And then, so I think everyone with MS needs to have a vitamin B12 level checked. If it's normal, there's no benefit to taking extra. And then the area that I think has dropped down some, but I still think it's not definitive, are polyunsaturated fatty acids, especially omega-3 fatty acids that are older studies with some suggestive evidence. But then the best study ever done came out a year or two ago from Scandinavia, and it was quite negative. But I don't think it's the final word. It wasn't the absolute perfect study, but in my mind that's dropped down some on the list.
I would love just to ask you one quick question in response. So when people hear about dietary supplements, right, you think about a person with MS who goes into Whole Foods and there's a whole aisle of vitamins. How do you make someone know what they're doing, or give them counsel or simple advice on how to get what they need and do it safely?
Right, yeah, I think that whole area has changed. I think up until, Well, certainly up until 7 to 8 years ago, and maybe even up until a few years ago, the thought was, well, dietary supplements either are going to do nothing or they're going to be helpful. And then the humbling thing was, starting back 15 to 20 years ago, some really high quality, huge number of people involved in these studies looking at very specific supplements in fairly modest doses, following up on studies done with foods that looked suggestive for a particular vitamin or mineral being helpful. And what's been found in those studies, and now are at least 15 studies showing modest doses of some specific vitamins and minerals at pretty modest doses can actually have negative effects. So it's not that it's doing kind of the shotgun approach where it's going to be neutral or you're going to get good effects. That's you have to be cautious with that. So it's more like a single bullet approach and very thoughtful about each particular supplement and how those are being used.
Well, and I know that you cannot prescribe all the webcast viewers exactly what to do, but it is a tough situation, even to hear you say that, if some is too much and some is too little, is there any simple advice you would give to someone trying to figure it out to do something right in terms of get pro-DHA, get pro-EPA, and do it okay? I don't know, Tim, you can comment too.
Well, I'll let Dr. Allen talk about prescribing or give the medical advice. I think one of the good news piece, though, is that when it comes to supplements and these types of topics, we are doing some clinical trials now looking at things like antioxidants, looking at lipoic acid to see could it have a beneficial effect of protecting the brain in a person with MS. Looking at green tea extract to, again, see can it protect the brain from damage. These are small studies in people, in human beings, but can these antioxidants mop up the free radicals that will damage the brain? These are the kinds of questions that we can start asking. I don't think 10 years ago we really could ask that question well, but now we have the tools like MRI to be able to actually ask that question intelligently.
Right. Yeah.
Do you want either one to go ahead?
Well, I would make a comment on trying to understand. As scientists, we always try to understand why. And so I think a great question to ask whomever you're seeking advice from as to your diet or supplements is, why do you think this would work for me? Mm-hmm. And if the provider that you're speaking with's answer is, well, it really promotes the immune system, we think it really is great for your immune system, I would pause. Because we don't really want to turn the immune system on in MS. If anything, we want to dampen it or regulate it better. And so if the answer that the provider has is pro-immune, I would ask another provider. I would seek a second opinion on that agent, because theoretically, if it does what the person's saying it's going to do, that could take you in the wrong direction. That's a very simplistic approach, but I think it's reasonable.
Yeah. It's nice to have some guidelines as a patient of, okay, maybe this is not good, maybe I should go a different path.
And I think the other part is I spend a lot of time with my patients and their families developing a relationship where they will tell me what they are exploring. And we have found some things that interact with the other medications the person's on, and therefore, instead of getting benefit from either, you're getting neither. So communication is really important. More is not better. There are a lot of times where too much is actually harmful. And then I think the other final thing would be mechanisms. So, we've been talking about diet. We should also talk briefly about obesity. And there are studies now showing that if you're a heavier set individual in late childhood or teenage years, you are more likely to be diagnosed with MS later. Body mass index, or your overall size, has been associated with other autoimmune diseases. And inside fat cells, there's a vigorous immune system. So I think we need to think about why these relationships might exist. And so back to being just a healthy diet, a healthy weight ought to be really an important consideration. It affects your ability to exercise. It affects many other health components. We have an obesity epidemic in kids and in adults. So that, I think, is an important thing to think about, too.
One thing that I think about and hear about all the time is gluten. So who wants to respond to what gluten is?
I'll do. So,
Here's the trendsetter.
All the heads, yeah. So gluten is actually a fascinating topic, and I think it's going to be change very much in the next 3 to 5 years. I think there's going to be major advancements in this area. The one area that's the clearest is celiac disease. That's very well documented sensitivity to gluten, which is a protein in wheat, barley, rye. And that particular condition, celiac disease, has blood tests that you can do, biopsy you can do. There's genetic risk factors for it. So it's a very well understood condition affecting 1% to 2% of the population. If you look at people with MS, most of the studies indicate it's 1% to 2% of people with MS who have celiac disease. So it doesn't look like there's from most studies, does not look like there's an overlap. The bigger question that we don't have the answer to at this point is non-celiac disease, but gluten sensitivity. It's called non-celiac gluten sensitivity. So that's a condition where people, when they ingest gluten, can have abdominal symptoms, bloating, discomfort, or they can have other symptoms anywhere in the body, and people with MS, by report, can have worsening of their neurological symptoms, a little like with a urinary tract infection. The gluten can kind of bring out someone's vulnerabilities. So this gluten sensitivity has been hard to get a handle on. If you look at the medical literature on it, it's incredibly confusing because there are no diagnostic criteria. So there's no way to diagnose this other than someone saying, you know, I have these particular symptoms when I take in gluten. So the next few years, I think there'll be major pushes to have diagnostic criteria. And then even before the diagnostic criteria come out, studies looking to try to define subgroups of people who, you know, what percent of people does limiting the gluten truly help them. The number now is 10 to 20%, but we might find over the next few years that it's maybe 1 or 2% who do have some kind of non-celiac gluten sensitivity, and then there may be people who feel there's a sensitivity, but we can't document any condition that's producing that. This is all complicated by the fact that there's a very large food industry out there that's producing gluten-free foods.
But again, from a patient perspective, it's very exciting to hear, you know, uncharted territory has chaos, right? But somewhere in it, there are results. And I feel like, Dr. Lowe, with your experience with retraining the brain, that's an example of a kind of a whole new domain.
Right. Well, just to respond a little bit about the diet, the medications and supplements, I think it's really an exciting trend is the fact that we're starting to test this. At one point, someone says there's no evidence. And sometimes no evidence is an easy but uninformed answer because there's no evidence, meaning no studies have been done. But what you may want to hear is people have done the best studies and we know it works or it doesn't work. This is true of exercise and rehab as well. There have been very few large rehab trials really looking at retraining the brain. And one of the things I've learned in medical school as a graduate student is neurons that fire together wire together. And that's one of the principles we want to do for exercise, rehab, repetitive training. And we've shown in a different study, a different population, stroke, that if you train people, even if they had a stroke 20 years ago, you can actually regain significant benefit in that paralyzed limb. Sometimes there's something called disuse atrophy. That applies to people with MS as well. If your leg or your arm has an impairment, you stop using it more, and that causes further decline in function. So we want to regain that through more rigorous kind of rehab protocols.
Sure. And the other item I kind of wanted to bring up that I keep hearing about is the microbiome. So, Dr. Kutze, maybe you can put that into context for people who have no idea what I'm talking about.
Sure. Microbiome, my favorite topic. No, so the microbiome is a fancy word that basically talks about all of the bacteria that live within the human body. And so we have bacteria on our skin, but a lot of it is in our intestinal tract. And, you know, as we've been trying to figure out what's happening, you know, in the intestinal tract and understand that biology, you know, what we're beginning to understand is that there are good bugs and bad bugs, and that, you know, sometimes the bacteria that are bad for us actually become dominant in the intestinal tract, and that starts talking to the immune system, and that starts a cascade that can actually be detrimental to a person living with MS or other autoimmune diseases. Like, you know, exercise and rehab and many of these other things, there's a lot we don't know about the billions of bugs that live within us. But the good news is that there's a lot of science that's being directed towards that to try to get an understanding, and, you know, even potentially the crazy idea that you could perhaps try to change the bugs that live within you to perhaps have a beneficial effect.
Yeah, I think there's potentially a very exciting area, and it really has been hard to explore because many of the organisms in our gut live without oxygen. You take them out, they get exposed to oxygen, and then you can't culture up the organisms. So there are very sophisticated DNA methods being used to identify what these organisms are. And then I think in terms of MS-specific studies, you know, some studies out of South America indicating when people with MS have, you know, fairly benign parasitic infections, they have less disease activity with their MS. And then some studies, I'll talk gently about it. We're getting close to mealtime here, but using hookworms and whipworms, so parasitic worm infections actually being induced in people that are benign parasitic worm infections, don't cause major abdominal issues, and some suggestive beneficial effects coming out of those studies, and then some early animal studies that I think are going to soon lead to human studies with very specific bacteria, some perhaps identified with these more sophisticated methods, identifying bacteria that have a beneficial training effect on the immune system or a modulating effect on the immune system in the gut that then translates to a modulating effect on the immune system in the brain.
And in fact, we're funding that study that, at the University of Wisconsin, and we're hoping that it's people with MS are taking these milkshakes with parasitic eggs, and the idea is can this perhaps reprogram the immune system in a beneficial way? And hopefully next year we'll know the answer to that question.
So how do all these studies and research fit into the MS Society's broader portfolio, Dr. Coetzee?
Well, no, that's a great question because we have a big portfolio. It's focused in 3 areas: stopping progression, restoring function, and ultimately ending the disease forever. For a long time we've been trying to understand how the immune system works and how the brain works. But now that we've moved to the place where we have a pretty sophisticated understanding of the immune system, we can then start asking these other questions like, how does rehabilitation, connect in with the immune system, and can exercise improve cognition, or can we have rewiring or reprogramming of the immune system? And it also fits in with things like vitamin D, diet, and exercise. This issue of other things that people live with, like obesity, cardiac disease. We're starting to think that those also affect clinical trials and the outcomes. And so, as we're trying to answer these questions about a particular complementary therapy, you have to stop and ask the question, what else is going on in that person's life that could confound what we're seeing? So, we're all scientists here, so we like cleanliness and precision, but sometimes these other things just affect the trial in ways we can't appreciate. So that's why we have to fund a broad range of research.
I think there's sort of a trend within American medicine and research. I think for years there's been this idea that you go to the doctor and there's sort of the hygienic clinic visit and you prescribe medications, and then the person for 99% of their life is actually living this life that you have no understanding of as a clinician, and every 3 to 6 months someone comes back, and sometimes in the worst case scenario they're having this awful lifestyle, awful diet, and they're getting diabetes and high blood pressure, which they're doing here, and then they go every 3 to 6 months to get the pills to deal with the condition caused by the lifestyle. So I think what we're seeing is a bringing of these two together in a way that I don't think has ever quite happened at this level in American medicine, or some sophistication to be able to understand the lifestyle and take it into the clinical practice.
And for you, who was deemed psychologically questionable, this is probably a very exciting time for you. You've turned out to be a trendsetter. Marijuana. Who wants to take it on?
I'll take that one. People with MS, tell us that marijuana can help them, and oftentimes it's for spasticity, pain, and fatigue. There's a lot we still don't know about what's happening there. We are funding some clinical trials to understand how marijuana could benefit an individual, particularly when it comes to spasticity. I think the important thing about it is that it does highlight the one big gap that we have in MS, and that's in terms of helping people manage the symptoms of the disease, and that we don't have very many tools, and the physicians don't have any specific approved therapies for pain and spasticity and fatigue. So I think marijuana points that there may be some benefit that we need to explore in some meaningful way.
I think this area is quite interesting. If you actually look at the studies, kind of lower to higher quality studies of marijuana-derived products. There are actually 19 studies out there of those types of therapies in MS. There also are 18 states plus the District of Columbia that have medical marijuana laws. I think it's very difficult, though, at this point, in spite of these 19 studies, it's very hard to translate what's shown in those clinical trials with clinical practice. And we've had medical marijuana in Colorado for more than 10 years, and it remains a challenge. Part of the challenge, as Dr. Coetzee mentioned, in terms of the therapeutic effects, most of these studies indicate benefit with pain, a person's sense of their own muscle stiffness, and sleep. The challenge is most of these studies have been done with standardized herbal extracts that are only available for research purposes, or the single molecule in marijuana, THC. What's happening in most medical marijuana states is availability of smoked marijuana or sometimes actually unregulated herbal extracts. So it's very hard to kind of blend those two approaches. But I think we're all going to be obligated to have some meeting to work this through with these laws passing. And then, Colorado and Washington, now it's medical marijuana is sort of old news, and now it's just available at the recreational level, and people are going to be potentially mixing it with their medications, and how do you do that appropriately?
Dr. Benoit?
Well, I just want to comment on the smoking versus extract or other ways, because there's also some literature emerging on the detrimental effects of cigarette smoke, particularly, on MS outcome and disability. And the biological part of that relates, at least in part, to what are a component of the immune system that exists within the lung. So my concern, particularly since I look after kids, is what the company of marijuana smoking may keep. So the smoke component of it itself is one issue, but I would be concerned about then promoting smoking in youth and young adults, which I think if the single biggest health advance of the next 20 years would be if smoking was actually to really drop dramatically in terms of all the other health impacts of smoking. So that's one of my concerns, and I think, I don't know if those two always go together, but I do worry that they would potentially run together, and the smoke effect would be a big problem. So looking at the components in marijuana and how they might work could lead perhaps to therapies that would have less health risk.
It's a very fair point, for sure.
I think that whole trickle down to the adolescent population, that's of high concern too, right? And then also multiple MS studies, there are the general health effects associated with marijuana potentially, and then in the MS studies, several have shown cognitive difficulties in people who have MS and have a regular marijuana use. So I think it's important for people to know that now that there are medical marijuana laws that allow use in MS, that does not mean that the safety and effectiveness in MS is known, and the only barrier we've had up till now is just the legalization aspect.
But it is one of those areas that Alan also, as he pointed out, is to have a conversation with your physician if at all possible, so that, if this is part of an individual's life, the physician has an ability to understand and sort of work with the individual on it, so that, if there's an effect on their treatment or something is changing in their life, they can really see whether or not that's a factor in contributing to it.
And I will say I was happy the National MS Society let me do this, so I actually wrote an article for Momentum a couple of years ago, and it's on marijuana reviews, all of what we know, what we don't know, and that's something we share readily in our clinic for people to actually develop a fund of knowledge in this area.
Well, it seems there's a real shift of things moving forward and kind of new domains. One of the items that has yet to go away in the National MS Society is progressive MS. So I want to believe with all this forward moving on the non-conventional side, you might have something to share on the progressive MS side.
Sure. So progressive MS is a priority for us, and it is for for many physicians I know who treat people with MS. They're very passionate about addressing progressive MS because of the challenge that we don't have any FDA-approved therapies for it. Now, that's not for lack of trying. There's been a lot of trials of the existing therapies to see whether or not they work in progressive MS, and they haven't as yet, but there's more that are underway. But what we're trying to do is focus our efforts on understanding what is progressive MS. Some of the science tells us that there might be something different about the biology of progression, and so we need to get a handle on that. And that's why we have joined up with our colleagues in Canada and the United Kingdom, Italy, and the Dutch MS Society, and actually a number of scientists from around the world to create the International Progressive MS Collaborative that is going to try to bring the world together around this problem because there's a lot of science that needs to be done in order for us to get the therapies we need to tackle progressive MS.
It's fair to say that finding there was a biological distinction in progressive MS was progress. Right? It was a big deal.
Oh, it absolutely was. And, Dr. Lowe and Banwell were at a meeting that we held in earlier this year just on the topic of progressive MS. And, we're starting to see an intersection of all these different areas. And I think what excites me is that the progress we've made in addressing the needs in relapsing and remitting MS creates a pathway so that we can actually get past some of the barriers quicker in progressive MS. And certainly I think Alan and Brenda, you might want to comment on what you saw at our meeting.
Well, for me, one of the things was that we've talked about not siloing our patients or putting people into compartment by compartment in terms of mental health or physical. In science, we need to recognize that there are many other neurological conditions that have a progressive component to them. And the meeting that we were referring to included discussions of other progressive diseases, how they've explored that component of the biology, both from a clinical and patient advocacy perspective and also from a scientific point of view. And I think one of the things that came through for me was the concept of what we're calling a cellular reserve. In other words, how much can a part of the brain handle before that part no longer works properly and the patient experiences a deficit. And understanding what makes a cell more resilient and what makes a cell more vulnerable can cross many different diseases. And there were some very, very exciting topics being presented, I thought, in that domain. And there are some potentially therapeutic strategies there that might be very, very valuable, and maybe we can partner with big groups that are studying other things and learn as a collective. And I think that came through very well.
You know, I thought it was an amazing meeting. They brought together an incredible group of investigators, many who have not seen for some time, but they also brought in pharma, they brought in advocacy groups, and all discussed what the barriers were to get a treatment for progressive MS. I was in the rehab group, and I think our group felt there was a lot of relevance in developing rehab and exercise for progressive MS, because that's actually one of the few interventions that's available for them.
Right.
And we noted as a group, you know, there's been no great cognitive rehab study that's been done. There's been no great exercise study that's been done. So as a group, we're actively starting to plan on that. But I think one theme you're hearing here is, whether it's marijuana or vitamin D, is that scientifically it's easy to prejudge some of these agents. But from a scientific point of view, we want to look at the agents objectively. You know, what's the mechanism? Why do we think it works? And to test, you know, both safety and efficacy. And also we talked about implementation. You know, the group that runs with marijuana may not be the best. We can come up with the best intervention, but if it's impossible to administer, that's not going to be a great drug.
What I think is great is that if a patient says, you know, but this makes me feel better. I do feel like there's a little bit of a progression. I mean, I got to be, for you guys, it's been very frustrating sometimes to not be able to have the clinical evidence behind what you're working with. And when someone says it does make me feel better, being able to move that forward. Before we wrap up, I would like to ask each one of you, what are you most excited about personally that's on the horizon?
You know, I'm particularly excited, in fact, we're making so much progress. And whenever we go to these meetings, people are very excited about it. They really want to develop something for relapse-remitting, progressive MS.
And that's really true.
It really
are
is
making
true.
progress, right?
It's amazing. So you kind of get motivated by that. I think in rehabilitation, one of the most exciting developments is try combination therapies, probably combining a pharmacological agent or a biological agent, because I consider rehabilitation not only rehabilitation, but repair, regeneration, and restoration. So would have the best opportunity to rebuild the nervous system in the rehab setting. So, for example, one of the few medications out now is dalfampridine. People are trying to combine that with exercise. There might be a better biological agent that comes out for regeneration, remyelination. We'd love to combine that with rigorous rehab protocols. I think that's a really exciting area for me.
Cool. Dr. Banwell.
I think the most exciting thing I've seen in the last few years is the removal of barriers to collaborative research. You know, the branding of research having to be done in a given university or a given hallway or a given lab has really changed to international consortia, like the meeting in Milan, where people that haven't seen each other, as we're saying, sat in the same room and said, you know, let's get the best minds together and tackle this particular problem. I'm part of the International Pediatric Multiple Sclerosis Study Group, which started with 7 of us at a meeting funded by the National MS Society a number of years ago. It's now 150 people in 40 countries that represents pretty much the majority of pediatric MS research collaboratives in the world. And that is the way to go forward, in my view. I think this disease requires people to think broadly, to incorporate alternate medicine providers and experts, with rehab experts, with neurodegenerative disease experts, and with clinicians who understand MS together. And the groundswell toward that type of collaborative research, to me, is what's really going to move us forward.
Great. Dr. Bowling.
Yeah, I think the openness to looking at these unconventional therapies, like we've said, that was not there 10 to 15 years ago. So there's an openness. There's really not even, there's very little of a taboo feeling about it. So there's an openness, and then many studies funded by National MS Society and others, MS-specific studies looking at these therapies, the safety and effectiveness. And then as we accumulate more information, I think at each step along the way, communicating the best we know to people with MS so there can be MS-specific recommendations or MS-specific guidance on what types of therapies to avoid.
Dr. Kutsi?
So for me, on the science front, I am really excited about the research that's being done to rebuild the brain, whether it's through rehab or through stem cell therapies or other types of strategies that can restore function and bring back what people have lost, particularly for those who live with progressive MS. But I'm also excited because it also is happening across the world, and people are talking to each other, whether it's in North America to Europe to Asia. You know, this is a global deal. And people are really working together in a meaningful way, in ways that I think we didn't appreciate could happen even 10 years ago. So I'm excited that the science is going to be conquered by the collaboration.
Wonderful. I want to thank our panelists, Dr. Albert Lowe, Dr. Brenda Banwell, Dr. Alan Bowling, and Dr. Tim Kutsi for being here today and sharing their expertise with us. I also want to thank you, our viewers, for joining us today. If your question wasn't answered, please speak directly to your healthcare provider or visit the Society website at nationalmssociety.org. You can also contact the Society's Information Resource Center and speak with one of our MS navigators at 1-800-344-4867. As always, our webcast participants have submitted so many excellent questions that we've not been able to cover them all. Fortunately, our panelists have generously offered to continue the conversation over the coming days on the MS Connection online community blog. Be sure to visit msconnection.org to catch their follow-up blogs and take the opportunity to connect with other visitors from today's webcast who want to share their own strategies for living well with MS. Please note that today's webcast will be archived and availavailable for viewing on nationalmssociety.org. Thank you, and goodbye from New York.